Hi there, my name is Kim and I'm going to be doing your teeth cleaning today. So as the receptionist might have told you on the phone, that the Dental Association still has restrictions on teeth polishing at this time due to the aerosols and COVID-19. So at this point we will be unable to do the polishing at the end of the appointment, but we will be able to do everything else. So I'm going to be taking some x-rays as well as scaling your teeth. The dentist is going to come in and do an exam, and then we will do fluoride at the end. Okay, you are not interested in having x-rays or fluoride. And can I ask why? Okay, so I actually get this a lot. Patients are concerned about the amount of radiation that they are receiving from the x-rays. So in terms of the digital x-rays that we have now, you do receive a minute amount of radiation exposure from that compared to if you were outside in the sun or even just on an airplane. So it is a very, very small amount. Okay, that is totally fine. I completely understand if you don't want to, and the fluoride as well. Okay, so one thing that I do have to let you know though is that without having x-rays, it is going to be very hard for the dentist to pretty much diagnose cavities, more so the cavities that are in between the teeth, so the x-rays actually help them see that. If there are cavities on the biting or chewing surface of the tooth, those they can see more so. So it's going to be a little harder for them. So, okay, that is completely fine. So you said for your next recall appointment in 6 months, we will update the x-rays for you as well as do the fluoride at that point. Okay? Okay, so you don't want an exam today either. So just scaling. Okay, that is fine. So let us get started. My instruments just came out of the sterilizer a little while ago, so I'm gonna open up my instruments. Okay, so my instruments just came out from the sterilizer a little while ago, so I am gonna go ahead and take them out of the sterilization bags and put them into my instrument kit, and then we can get started. So I've put all of my instruments into my kit. So let's get started. see what we're working with today. Okay. Okay, so you do have a lot of calculus, and no, I'm not talking about not the math calculus. So basically, you've probably heard it being called tartar. And what tartar and calculus is basically hardened plaque. So, over time, when you have a lot of plaque, after a while, it starts to get hard on the surface of the tooth. Sometimes it even goes beyond the gums. So it goes subgingivally. And you do have calculus, which goes a little deep under there. So, with today's appointment, I'm going to try to do as much as I can. But if we do not finish today, we will just have to book you back for another appointment just to finish up, okay? But I'm gonna try to do my best. Okay. So, so these are the scalers that are used to basically clean all of that tartar from around your teeth and your gums. So that's all I'm doing right now, is trying to take all of that off. Yeah, I know these instruments are pretty cool. This one's called a sickle. Yeah. And I do apologize. I know that sometimes I ask you questions and I'm trying to talk to you, but my hands are in your mouth and you can't talk. So I'm sorry, it is just habit. So bear with me here. Okay, and how often do you brush your teeth per day? Okay, just once a day. In the morning. Okay. So what I would suggest doing is try brushing twice a day. So, in the morning, either once you wake up or after you have breakfast, or and also right before you go to bed. Trust me. Do you wake up in the morning and your breath is not all that good? It doesn't smell that good, I mean. Yeah, so even doing that, like brushing right before you go to bed, that helps a lot. in terms of your breath in the morning, and also it is just good to brush your teeth before you go to bed. You're basically brushing and cleaning up everything that you ate that day or since brushing in the morning. Okay, I'm gonna just do some on the top here. And how often do you floss? Okay, you don't. Alright. Alright, so we gotta get you working on that, okay? Because it is very important to floss. I don't think you notice, like, the things that you eat, certain things that you eat, it gets caught in between your teeth. I mean, the food that's between your teeth, just think of it staying there and, like, rotting. Yeah. So, I mean, that's how a lot of people get cavities in between their teeth for not flossing. So, yeah, flossing definitely helps prevent cavities that form in between the teeth. So it is very important. I know it's not fun to floss, but I mean, if you make it a habit and you start doing it more often, I guess it just becomes part of your routine, right? So, I mean, what you can do is, if you are watching TV or something, you can try flossing while you're doing that. So, at least you're still kind of entertained a bit. Okay. So, I do see you have a couple chips at the bottom, your bottom arch. Yeah. Do you grind or clench your teeth at night that you're aware of? Yeah, you think you do? Okay, and do you wear a night guard at all? No. Okay, so I mean, if you are interested in getting a night guard, we can definitely do that for you here at the office. So it's gonna be something that's gonna help you from grinding and clenching at night. Do you ever wake up with headaches? Yeah. Yeah. Okay. So a night guard is definitely going to help you. So all you have to do for that appointment, basically, it's 2 separate appointments. So the first appointment, you come in and we take impressions, so molds of your teeth, and we send that off to the lab, and then we bring you back for the second appointment, and that's basically where you try in the night guard at that point. If there are any minor adjustments that need to be made, we can do that as well at that second appointment, and then that's it. You go home with your night guard. Trust me, it's going to be your best friend. I wear a night guard, yeah. I'm not gonna lie, at first I hated it. Like, I got a night guard, and okay, this is before I started working in this profession and going to school for it, so I can tell you this now. But before, I had a night guard, and I never really wore it. And then when I started getting headaches, and I started, like, I would wake up and my teeth would hurt. Yeah, just from clenching all night, my teeth would hurt. So I decided to try the night guard in. Guess what? It didn't fit. So yeah, so your teeth do shift. So with any appliance that you may have in the mouth, if you start wearing it for some point in time, it may not fit because your teeth do shift over time. So at that point, I had to go back into the dentist and redo the impressions, and I had to get a new night guard. So yeah, so I'm just letting you know, when you get it, wear it. Please wear your night guard. It's also going to become your best friend, trust me. Yeah, like I said, at first I did not like it. Sometimes I would wear it to go to bed, right? And the next morning, I will wake up with it on my pillow. Oh, I know. I don't know. I can't remember how it got there. Obviously, some point in the night, I took it out because it was so uncomfortable. But yeah, that was just at the beginning. Yeah, just at the beginning. And seriously, I am in love with my night guard now. I go to bed with it every night. And sometimes if I fall asleep without it, I wake myself up because I'm not wearing it, just to put it in. And it definitely helps. So with my headaches, I don't really get them as often, and I'm not clenching at night, so I'm also protecting my teeth. So yeah, I'm not grinding my teeth down. So yeah, it's definitely something that you're gonna look into. Alright, that's good to hear. Yeah, so once we're done the appointment today, the girls at the front, I would just let them know that you are interested in getting the night guard, and they'll make that appointment for you. Do you have insurance? Okay. Yeah, so we can definitely send that off to your insurance company and try to pre-authorize it. So they'll let us know if it will be covered and how much they will be covering. So yeah, we can definitely do that for you. Okay. No, not this one. Yeah. Okay. So again, I'm just letting you know, you do have a lot of buildup on your teeth. Your gums are also inflamed, and again, that's because of the amount of calculus that you have. So definitely, either if we finish everything today, after today's appointment, your gums are going to be so much happier, less red and puffy. Okay, and on this tooth down here, so it looks as though this is on the biting surface of the tooth. It looks as though this might be the start of, you have a little cavity here. I'm just gonna put my instrument around here. Let me know if that is sensitive. Oh. Okay, I'm sorry. I'm not trying to purposely hurt you here. Okay, so that is a bit sensitive. Yeah. So I'm going to note that down. So my notes for your chart, and also because you're not having an exam today with the dentist, so that will be in the notes for the next time that you come in. So basically we are going to put a watch on this tooth, okay? So what I would say right now, just keep an eye on this tooth, brush the area really well every day. Remember, twice a day. Floss as well. Just try to keep the area as clean as possible, okay? Until your next appointment when we do that exam, because, you know, you may come in before that complaining of a toothache, and you don't want this cavity to turn into something much bigger, because then at that point you're going to need a root canal, and that's not fun, trust me. Yeah, you know. I can see from your old x-rays you've had a couple root canals done before, so you know what it's like. Yeah, so again, just take good care of this tooth before you come back. Okay, so if you want to just come in again at some point before your next cleaning, just to have an exam for this specific tooth, we can do that as well. It doesn't have to be a full exam. Yeah, we can wait till your next cleaning. Yes, again, that's in 6 months to do that. Okay, so this is starting to look much better. I do apologize, I'm really sorry. Yeah, I know it's really sensitive around there, and your gums are bleeding a lot right now. And that is another reason why you need to floss. So some people, if they floss or when they're brushing, sometimes they see blood. Or if you are flossing and you see blood, like some people get scared and they stop flossing. That's not what you want to do. The more you floss, the less it will bleed, so it will eventually stop bleeding. So just continue flossing, okay? Yeah, so it will stop eventually, and then you can just continue flossing and just include that into your routine. Yeah, this is it's tough piece here that does not want to come out. And again, yeah, I do have to go a bit under the gums here, so your gums are going to be a little sensitive and a little sore today after the appointment, even up till tomorrow or so. What you can do is you can do a warm salt water rinse, just kind of swish around the mouth with that today. So you can do that this evening. You can do that tomorrow. So you can do that a couple times a day. That would definitely help. And again, the more you floss, the less inflammation that you're gonna have of the gums as well, okay? Yeah, I know you say you're listening to me, but that's what all of my patients say. I can definitely tell, but just by looking in the mouth, who flosses and who doesn't. Even when I ask patients if they floss, I know if they don't. So, okay. We're pretty much almost done here. So yeah, we're gonna be done the whole thing today. So yeah, that's good. You don't have to come back for another appointment to finish off the cleaning. Yeah, so the next thing that you'll have to come back for is just gonna be the impressions for the night guard, and then a week later coming back to try it in. Yeah, the girls at the front will again, you want us to send it off to your insurance first, right? Okay, yeah, so we will do that, and once we hear back from them, sometimes they send the information directly to us. Depending on your insurance company, they might send it to you. So if you get it first, give us a call, and then we can kind of set up the appointment at that point in time. If we get it, we will give you a call and set up the appointment, okay? But yeah, so we'll just wait to hear back from your insurance, and we'll book both the appointments at the same time. Yeah, for the impressions, it's not a long appointment at all. It's literally 15-20 minutes to do the impressions. Yeah, that's it. And then usually the appointment to try it in is sometimes shorter than that. Sometimes try it in and it's perfect. It doesn't need any adjustments. Sometimes it may need some adjustments. But yeah, these aren't long appointments at all. So definitely not as long as this cleaning. Okay. So yeah, you usually have a lot of plaque along the gum lines. Okay. So I'm gonna show you after this, like the better method for brushing your teeth. So do you have a manual toothbrush or an electric toothbrush? A manual, okay. So I'm gonna show you at the end of today's appointment basically how to brush and to get close to the gum lines when you brush, okay? I'm gonna show you. Don't worry, you're gonna like it. I'm not gonna be showing you like as I'm brushing your teeth or with a mirror. This way you can actually see better what I mean. Okay. Alright, I am just finishing up here. Okay. And we are done. That wasn't so bad, right? Okay. Alright, so as I was telling you, I'm gonna kind of show you some brushing techniques here. So I do have my handy dandy toothbrush, and I have my little friend over here, Mr. Big Mouth. So yeah, I'm just gonna show you how to brush. So you do have a manual toothbrush. Electric toothbrushes are better, honestly. But if this is what you have, I'm just gonna show you how to use it, okay? So basically what you want to do with your toothbrush, the bristles, you want that for the bottom arch. You want that facing towards the gum, and what you are going to do is gently brush, so close towards the gum surface, and do a swoop up. Yeah, so brush and swoop, brush and swoop, brush and swoop, brush and swoop. And you basically want to do that all the way around, okay? Just like this. When it comes to the top arch, you're basically doing the same thing. So bristles towards the gums of the teeth, and brush, and this time you swoop down, okay? Brush, swoop, brush, swoop, brush, swoop downwards for the top. In terms of brushing, and especially when you are at the gums, you do not want to brush hard, okay? That is a big no-no. Usually for people that are aggressive brushers, that means you brush really hard, so also like on the surface of the tooth as well as the gums. What happens in that case is it causes recession. So it causes recession of the gums. So in that case, the gums at the top, they go upward, they start receding. The gums at the bottom, they go downward. Once that happens, there's no going back. I mean, you can get gum grafting done, but that's like if it's really bad. So I'm just going to tell you now, because I do see that you do have some recession. So when you come for your next appointment, for your hygiene in 6 months, at that point I'm going to do some probing, okay? So I'm going to be measuring the distance, the pockets that you have, and the recession. So again, you need to stop brushing aggressively. Alright, so just really soft brushing swoops, okay? On the biting or occlusal surfaces of the teeth, you can just go back and forth like this. Same for the top. Okay, so that was me showing you how to properly brush your teeth. So yeah, so that would help with the plaque accumulation that you have around your teeth and gums. So to hopefully help you not have as much tartar and calculus, okay? So in regards to flossing as well, what you want to do, because you don't really floss that often, but with the floss, instead of letting it basically being aggressive through the teeth like this, you don't want to floss up and down like this. So with the floss, you wrap it around your fingers, and once you get up in there between the teeth, you want to basically curve the floss so into a C shape around the tooth, and then you want to go up and down around the tooth, okay? So don't just go up and down, because when you're also going to hurt your gums, which you don't want to do. So okay, you don't want me to floss today's appointment, because we usually do floss, but if you don't want to, I hope that you are going to go home and floss. We will be giving you a toothbrush to go home with, as well as a little toothpaste and floss. So I hope that you floss tonight. I hope that you brush tonight. So you're gonna be brushing twice a day now, okay? And yeah, I can walk you up to the front. I'm gonna let the girls know that we are gonna be pre-authorizing the night guard with your insurance. Okay? It was nice to meet you. I know that I'm not your usual hygienist, but it was nice talking with you today. And yeah, we will see you in 6 months. So take care and happy brushing.